Okay, folks, we are at 2 o'clock here. I'm going to start kind of a longer introduction than normal. My name is Jeff Clark. I'm a regional director here with GoldenCare. We're going to be doing a topic of Medicare. This is kind of a newer brainchild. We haven't really done anything like this. You know, we're more of a long-term care shop, and we do a lot of short-term care and home health care, and we have all the products in that area. But, you know, consequently, we end up running a lot on MedSup. We end up doing millions in premium in MedSup, Med Advantage, and more of our brokers are leaning more that way, of course, as the Medicare arena heats up. There's just so many products and opportunities there. So we have a lot of our agents that maybe do long-term care or life insurance, but want to get involved in more Medicare. And so I do get a lot of questions from people that are brand new. And so with that, this webinar was meant to be for people that are brand new to Medicare. If you're a Medicare expert and you're someone that's writing on up and doing, you have lead, this is not for you. I advise you just to probably don't waste your time with this. This is for really people that are newer, want to get involved more in Medicare. They're just not really sure how to get started. And so what I kind of did is I'm just telling you my own pearls of wisdom, things that I've done writing. I've been in the business for 25 years. I do a lot of long-term care, but I probably end up writing, I don't know, 30, 40 Medicare supplement apps a year. I don't do it full-time. My job is to recruit and train typically, but I do write quite a few MedSups, Med Advantage, prescription drug plans. It really ends up helping out a lot of my family and friends. It's just kind of grown from there. But it's such easy sales, and if you're not involved in it, I think you should be. One other housekeeping item. The reason I am working remotely today, there's a lot of moving parts to this, so I'm not going to put this on presentation mode. I know the screen's a little smaller. I'm going to be switching to the internet. I'm going to try to do some supplemental quoting websites. So I'll be kind of jumping around a little bit, and because the reason I'm home is I had some water damage, of all things, and so I've got a water restoration or cleaning company showing up at my house here anytime now. Fortunately, my wife just got home, so if we hear dogs barking or those folks showing up, I'll try to keep that to a minimum. But anyway, so that's what I've got going here. That's why I'm home. But without that, I want to kind of get started just talking about Medicare. Kind of my intro. A lot of people are interested in Medicare. They want to get into Medicare sales because it is such an opportunity. And so today I'm just going to go over 5 quick topics. I'm going to talk about how booming an opportunity Medicare is, and then just basically knowing and understanding Medicare. I'm not going to go dive deep into Medicare here. That's something you're going to probably have to pick up some guides. I'll point you in the right direction how to get some basic Medicare information. But you really have to kind of understand how Medicare works, and then you have to kind of understand how the supplemental products work that go along with Medicare. When you hear Medicare Supplement or Medicare Advantage, kind of understand what those things are. I'm going to go over that. And then, when you get started, you really want to have the right mix of products. Which I hear this a lot. Which carrier should I add? Should I get this company? Should I get that guy? I'm going to show you how to look in your own market and do some research and add the companies that make sense. GoldenCare has dozens of companies, all the big reputable companies. So no matter what area of the country you're in, we'll be able to find a good product for you or a good mix of carriers. I'll show you how to do that as well. And then just lastly, I'm just going to show you how to get started. I'm going to show you how to go grab some low-hanging fruit out there with the annual enrollment period coming out right now. There's just a ton of opportunity, so that's kind of an outline of what I'm trying to cover. I should be able to get this done in about 30, 40 minutes. So I'll have you type some questions in. I'll try to follow up on those at the end. I'll read some. And then, I don't know, Lynn or someone at the home office there, I'm getting a little bit of background noise there. I'm not sure where it's coming from, but okay. So with that, a booming opportunity. So Medicare sales, if you look at our country, we're aging amazingly as a country, right? Our senior population, I've seen graphs like this for the last 10 years. The fact that there's so many million. I put together some numbers, I guess I like to, the aging of America, Medicare. So the popular stat out there is that we hear everywhere. There's 10,000 people turning 65 every day in this country. And it's a little more than 10,000 if you round it out. It's closer to 11,000, but that's a lot of folks turning 65 every day. But keep this in mind. There are a lot of folks that work beyond 65 now. It's very common that people work to 67, 68. And so they're kind of deferring that Medicare, starting their Medicare until they retire. So each and every day, you've got another 1,000 people who work beyond 65 that are now entering the Medicare market. On top of that, anywhere from 500 plus, more people become eligible for Medicare via disability every day. I know in our shop, we write quite a few of these people that are under 65 that have been disabled for more than 24 months, they automatically get enrolled in Medicare. So you've got, anywhere 500 or more. So, it's hard to say the numbers here, but you've got 12,500 roughly new Medicare recipients each and every day in this country. And by the way, that number is growing. 21,000 per day by the year 2030. Just think of that. It just, if you want clients these aren't prospects that might buy something. In other words, it's not like life insurance or long-term care. They have to buy something. They get enrolled in Medicare. They have to buy the coverage that goes with it. So this is a captive. They're not just voluntarily buying this. They have to get something. So it's just a huge opportunity. Another thing to keep in mind, I put in the bottom here, the employer-sponsored coverage. Many companies used to offer some type of retirement coverage, retirement plans. Sometimes they were Medicare-style plans that worked with Medicare. Some didn't. But, as the economy gets worse, companies are struggling. You're seeing less and less companies offering these employer-sponsored plans. So it's flooding the market with people who need Medicare coverage. 1 out of 8 Americans are 65 plus in 2010. By 2030, 1 out of 4 Americans will be 65 plus. So basically, a quarter of the country is your market. It's gigantic. So, okay. And the opportunities. Now, people get hung up on Medicare. They hear about this AEP. But like I just showed you, there are 10,000 people aging in every day, actually closer to 12,500 people that are entering Medicare every day. So this isn't a once-a-year thing, just annual enrollment period. People get all kind of, and we did do this webinar kind of in lieu of annual enrollment because there's opportunities there that surround the annual enrollment period. It happens October to December. So I'll touch on that. But just kind of keep in mind that there are people aging in year-round. There are people retiring. There are Medicare supplements. People can be shopping these all year round. Most agents will tell me, or clients even, oh, I can change my Medicare supplement like in April. Yeah, you can. It's only the Medicare Advantage plans that are affected by this annual enrollment period, and the prescription drug plans. And I'm going to show you this in my presentation, Low-Hanging Fruit. People pay way too much for their Medicare supplement coverage. They should be renewing that or reapplying every 3 or 4 years for big savings. I'll show you how to do this. But that's something you can do all year round. So it's not just then, of course, there is the annual enrollment period, AEP. This is between October 15th and December 7th. This is when all the Medicare Advantage folks can change their plans, can add a Medicare Advantage, but they can leave their supplement, maybe try out a Medicare Advantage plan. If they're on an Advantage plan, they don't like it, maybe it discontinued, all kinds of things there. They're changing their plans. I think of it as a big game of musical chairs. In October to December, the music's on. And by December 7th, all those people are going to be sitting again in some place. So they're really up, moving around, shopping. So it's a great time to talk about not just the Medicare Advantage folks, but we see that the Medicare supplement folks, hearing all this going on, all the commercials on your TV right now are all about, annual enrollment period. Humana, United Healthcare, Aetna. They're flooding the market with commercials. So everyone's thinking Medicare right now. So it's a great time to kind of start that conversation, if you will. The OEP, this is after the AEP is over. If people didn't like where they ended up after musical chairs, the government now, starting in 2019, is giving them another 3-month period after the AEP to go ahead and change your plan. So the first quarter of the year, if you didn't like the plan you end up with, you can actually change it again in that OEP. So there's all kinds of opportunities to create revenue or create sales opportunities. Okay. Knowing and understanding Medicare. Now, I'm not going to go dive deep in here. I'm not going to get the Medicare and You book and bore you to death with 98 pages. I will tell you a couple basic things, and then I'm going to give you some reference guides to where to get more information on that. So, first of all, what is Medicare? Now, I do have a couple slides of the basics here. So it's a social insurance program established by Congress in 1965. It's administered by the government, a government agency called Centers for Medicare and Medicaid Services, CMS. It provides health coverage to over 60 million people ages 65 or older, people with certain disabilities under age 65, anyone with Lou Gehrig's disease or end-stage renal disease. So it's a big program. All right. Know your ABCs. Medicare, and so it's a literal of A, B, C, and D. Now, if you'll notice this original Medicare, you hear this term used a lot. That's A and B. That's what started in 1965. Medicare had 2 parts to it, Part A and Part B, hospital insurance, medical insurance. Part C and Part D came along around 2005, 2004, I want to say, maybe even 2006. So that's when you started seeing prescription drug plans and Medicare Advantage plans. And really, a lot of that was because Medicare Supplements didn't have drug coverage. So if you wanted one with drug coverage, it made it very, very expensive. And so these Part D coverage really are a saver for many seniors out there with their prescription drug costs. So it's really a nice program that they did add. It saved a lot of clients I had anyways from huge prescription costs. But so A, B, C, and D of Medicare is all you really kind of have to understand. So the original Medicare, again, that's A and B. Hospital insurance, the major stuff, heart attack, stroke. You end up with a car accident, you're at the hospital. Part B is that's your clinic. You go see your doctor for, you got a cold, you need some antibiotics, maybe a twisted ankle, you need an x-ray. That's your Part B. And so A and B. Most people have A and B. And on this, again, this is just one of these things. I end up explaining this to a lot of my clients, a lot of my agents. The Part B, there's a penalty there. They have to have A and B. So I'll tell you right away, in Medicare sales, what you're really doing with folks, especially when they're getting ready to turn 65, or even sometimes when they're retiring after fact, is they're just all nervous. They don't understand what if they have to add Part B, does it happen automatically? Part A happens automatically. As long as you work for 10 years in this country, you're going to get Part A. But Part B can be deferred. You don't have to add it right when you're 65, because some people, again, do work beyond their 65th birthday. They stay on their company's employer-sponsored plan, so they don't have to pay for anything. So why would you sign up for Part B? Part B costs $148 a month. So most people, when they enter Medicare, are going to need to have the A and B activated. So if they're already drawing Social Security, they're automatically enrolled in B. If they're not, I usually advise my clients, 3 or 4 months before their 65th birthday, they should be calling the Medicare office to make sure they are going to indeed start their Part B, because they don't have any other insurance. Now, if they're still working, they don't need to yet. They can defer that. They can avoid that penalty as long as they have credible coverage to their employer. And so there's some of this understanding A and B that I can tell you, I end up helping a lot of my clients just with understanding when they activate B, when they don't. Some people go ahead and activate Part B when they're 65, when they didn't need to, and they're still paying for their employer plan or paying a portion of it, or they have insurance. So, it's funny how little these people understand about their Medicare coverage, and they get so nervous, and it's a big thing for them. Not all of them, but 3/4 of them are very. So if you can kind of be a guiding service for them on even how to set up what is Part A, what is Part B, how do you get it set up, call the Medicare office, make sure you'd be surprised how much of a friend you make with that client. They trust you. So, okay, so the A, B, and C. Part C, again, came along in 2006. Well, this is Medicare Advantage plans. These are things you see on TV, Joe Namath. I'll address that later. A lot of commercials for this. The Medicare Advantage plans are a type of Medicare health plan. It's offered by a private insurance company now. What's happening here now is a private insurance company is managing your Medicare instead of the government managing your Medicare for you. So you still get all the equivalent benefits. They're just handled differently with co-pays and different kind of things. So, again, I'm not going to get real deep into this because you guys can do your either training on this or do some reading. Most, but not all, of these plans usually include prescription drug coverage. They have out-of-pocket expenses. They're PPOs, HMOs. These plans can also include things like dental and vision and hearing. So they're kind of a comprehensive catch-all plan that have really, they've really become more and more popular. So it's Part C of Medicare, but it's Medicare Advantage. Hasn't been around forever, but they're coming more and more popular as people kind of like to bundle all their coverage into one little plan there. Okay, prescription drug coverage, that's Part D. I always tell people it's pretty easy. D for drugs, right? Part D of Medicare, D for drugs. Helps cover the cost of prescription drugs. It's run by Medicare-approved private insurance companies that, again, they're kind of organizing this. They put all the drugs in these formularies. So you have tiers. They're all kind of set up the same way with 5 tiers of drugs. They have a coverage gap. There's some have deductible, some don't. So these are plans, and I'm going to talk about that, how to kind of show people help save money on the prescription drug plans. This is an area, again, too, where the average Medicare person out there is so lost with this stuff that if you can help them, guide them through how to find good drug coverage, you don't get paid a lot for this, but I can promise you, you'll get their Medicare supplement coverage. You'll probably end up getting a client out of it. I mean, you'll get the life insurance, you'll get all of it, because they just need help with this. And believe me, the people really need help in this area. I see people that are overpaying for their drugs by literally hundreds of dollars a month because they just don't know any better. And this is something I'm going to try to teach you how to help them with. Okay. So, know and understand Medicare. And as a wrap-up here, Medicare was not designed to cover everything. With Medicare A and B, there's co-payments, deductibles. This is why you need to enroll in something like a Medicare supplement or a Medicare Advantage plan. I'm going to explain what both those are. A couple more slides here too. No matter which way you go, remember you have to add drug coverage. So Medicare, original Medicare, it was never meant to pay everything. So we've always had these supplemental plans, Medigap or Medicare Supplements. Now we have Advantage plans as well as an option. So the Medicare Supplement Advantage plans fill in these gaps, cover the things that aren't covered. All right. So to know more about what I just talked about, and again, I don't want to spend a lot of time on that. It was just a brief overview, a couple guides, and I think you're going to get a copy of this PowerPoint. And I think like there's a link there to go to the AHIP training. That's an actual course you can take. Counts towards your insurance continuing education. So a lot of us, are struggling to get our 12 or 15 hours, of CE in a year. Well, then AHIP chews up 8 hours of it for you, or 6 hours, I think it is. So it's usually costs about $150, $175. A lot of carriers, Mutual Omaha, Humana, will help you get licensed with some of these. They'll then, knock $50 off the course for you. And I know with like Humana, as soon as you write 5 pieces of business, I get a check back for my AHIP training. So, but to do any Medicare Advantage stuff, you're going to have an AHIP certification. Not saying you have to. If you want to just do a couple supplemental things here and there, maybe walk people through how to do a drug plan, maybe not sell it, but just kind of help them with it. You don't have to do AHIP. I would suggest it. If you're going to be doing Medicare, you might as well do all of it if you're going to do it type thing. But there's also Medicare and You, and also choosing a Medigap policy. Those are both, if you really can't sleep at night, you need some light reading. Those are great guides. The seniors get these every year. They're 100 pages of a lot of stuff, a lot of information. So you can get those. We have them available on our website. And so I would suggest thumbing through those or doing the AHIP training. So between those three things, there's a lot to guess. You can really get deep. But I wouldn't. Some agents really think it's so much that they get these 100 pages. They feel like they can't sell because they don't know every little intricacy. 3 pints of blood and what if this particular steroid injection is a Part B. These things come up. I mean, I've been doing Medicare work for 20 years now. There's still things I have to look up. Things are changing, evolving. So just get a general grasp of it. You just enough to be dangerous, if you will. We'll help you with that, by the way, too. You can always call our marketing office. You can ask for me. Again, we do more of the long-term care, but if you have a Medicare-style question, I'm going to probably leave myself open to anyone that attends these. We're going to do a couple seminars on Medicare. So just ask for me, Jeff Clark, and I'll walk you through a lot of stuff. I don't mind helping agents getting going because it really is teaching them how to fish. You don't have to do all of it for them, but once you get them started, it's pretty self-going. Okay, so knowing and understand Medicare supplemental products and plans. I've already kind of touched on this, but there are two things that people do. When I'm pitching supplements, and again, I'm expecting these people at my house here to get this water. So if I may just have to pause this for a second and deal with them, but they should be coming. So when I talk to my clients, when I'm selling Medicare plans, I tell them there's two paths. And this. I'm just going to give you my I don't know. I'm sure some of my people in my office that are listening to this have probably heard me say this, but when people enter Medicare, this is what I tell my clients. There are two paths that people go down. One's a Medicare supplement, or it's also called a Medigap. One's a Medicare Advantage plan. And so those are the two choices, the two paths that you have when you enter Medicare. And so briefly, a Medicare supplement, pretty simple. You pay a little bit higher premium and everything's covered. You pay about $100, $125 a month, and that means you go to any doctor you want. There are no networks and there are no copays. That's it. I can explain that literally in 30 seconds like I just did. So Medicare supplement, full coverage, about $100 to $125 a month. You go to any doctor you want in the country, you don't pay anything. Very simple deal. Medicare Advantage plans, now these are things can save you some money. If you're pretty healthy, you only see a doctor a couple times a year, maybe once a year. Well, the Medicare Advantage plan can be as little as $0 premium, $50 premium, $100 premium. And they're going to have all kinds of corresponding copays for everything you do. Maybe $10 at a primary, $40. The easiest way to explain it, ask them if they had the insurance, through their work. We all have insurance through our work, right? Well, that's kind of how Medicare Advantage plans work. They have networks of doctors to stay in. They have corresponding copays. They have a maximum out of pocket. And so that's kind of the Medicare Advantage world. The one thing they should know when they're entering Medicare, when you first enter, you're in this, they call these open enrollment period. It's your first entrance into Medicare. Because it's your first entrance into Medicare, you don't have to answer any health questions of any kind. You can pick either one of these paths. There's no problems whatsoever. Now, Medicare Supplements, the full coverage option, they do have underwriting questions and things to be answered beyond open enrollment. So if you start out with a Medicare Advantage plan, and maybe 3 years later you get cancer and you maybe have a stroke and have Parkinson's, and you're starting to get all kinds of copays, and you want to go back to full sup, you can't, because you have to pass underwriting. So there is a rule that you can try out an Advantage plan for up to 12 months. If you don't like it, you can go to supplement. But generally speaking, when people are first entering Medicare, I don't care if they're turning 65 or if they work beyond 65 and at 67 or 68, they've now started their Part B of Medicare. They dropped their employer coverage. They retired. So they've delayed their open enrollment period. So when they're in that period, that's when you can get a supplement, especially if you're someone who's had a history of cancer, you've already had a stroke. Well, then I tell clients, get the full coverage while you can. It's about $100. They're used to paying $600, $700, $800. So a full coverage med sup is not a bad way to go. I can tell you that about 60 to 70% of the country starts with a med sup and currently have med sups. Depending on the part of country you're in, Florida, for example, it's about 50-50 down there. The Medicare Advantage plans are really good down there. They have good dental benefits, good vision. There's next to nothing for premium and $0 copays. And so the Medicare Advantage companies have been nipping at the heels of supplement companies for some time, trying to add more and more benefits. This is when you see the Joe Namath, are you getting all the Medicare benefits you deserve commercials? They got Kelsey Grammer doing it, and they also have J.J. Jefferson, I noticed too, doing these commercials. So we're seeing more and more of this. They're trying to woo people off of these Medicare supplements with the extra benefits. And you know what? There's no right answer here. You know, for my clients, I don't know, probably half my clients are on Medicare supplements and about half are Advantage plans. But I'm really involved with them. I'm changing those Advantage plans. I'm making sure the drug coverage is right for them. The doctors are working out. So, you know, the Medicare Advantage is certainly a lot more work, a lot more involved. But I have people that say, look, for $100, I want to be just full covered. That's half the people I start out with. I just put them on a med sup, probably 60% of them. We do a med sup, we don't look back. So anyways, it's a lot. That's why I tell my clients there's two options. So when you're selling and doing this, that's all you have to tell people is there's two ways to go. Med sup, full coverage, a little higher premium, no copays, no networks. Medicare Advantage kind of works like your current insurance that you had at work. Copays, networks, that kind of thing. Okay, I got a couple more here on this. So going into med sups a little more thoroughly. Again, you're going to get a copy of this. So I'm going to go through this a little bit fast. I want to go to the how to get started scratching some apps here. I'm at 23 minutes after here. I wanted to be done by 2:40, 2:50. So med sup, I'm going to send you a copy of this. So I'm not going to go deep into this, but Medicare supplement plans are standardized. They're full coverage. They have plans like A through, and I think I have a grid here. Yeah, they have plans A, B. This seems like a lot. It seems like if you look at, I can tell you this, almost everyone buys plans F and G. F was actually discontinued January 1st of 2020. So all new people can't even get F anymore. So what we're selling a lot of now is Plan G. Plan G and sometimes Plan N. The rest of these plans, I can tell you out of 50 supplements that I sell, I'll probably sell something other than G or N maybe twice. It just doesn't, it's pretty rare. So just understand Plan G. And if you'll notice Plan G here, everything's covered. So, you don't pay anything. The only thing you have is this Part B deductible that you're responsible for. It's $203 a year. So you pay $200, everything else is covered. So that's Plan G. It's what I sell 99% of the time. Okay. So supplements are pretty standardized. Plan G is Plan G, whether you write it with Mutual Omaha or if you write it with, Cigna or Aetna or United Healthcare. Plan G is the exact same. So what you're looking for, and I'm going to show you this in a little bit, we're just shopping premium rate. Obviously, I don't want a C-rated company, a fly-by-night that's going to be gone here, raise rates through the roof, and then drop you or disappear or go bankrupt. We want to have an A-rated company, a reputable company, and we want to have a good premium rate. I'll show you that, how to shop it. Okay. So 5 reasons to pick a supplement. Well, it's no out-of-pockets, no copays. It's guaranteed renewable. They can never take it from you. It's good anywhere in the country. And it's portable. It goes anywhere you want. If you move, the plan comes with you. Okay, Medicare Advantages, they don't do that. Medicare Advantage plan. So briefly on this, Medicare Advantage plans, I talked about they're managed by private companies. The private company manages your Medicare for you. And so there's different corresponding co-pays and networks, and all of them are similar, but they're all going to have one might have a $10 copay for primary, one might be $20. One may have a $250 per night hospital copay for up to 5 days. Another companies might be $350 for 4 days. But you want to look at the summary benefits because they're all kind of in the same category. And so if you're working in a certain market, you get to know the ones in your area, and I'll show you that again how to pick those out. All right, Medicare Advantage plans continued. Again, a lot of stuff. I'll let you read through this. They're HMOs, they're PPOs, they're private fee-for-service. There's a lot of types of Medicare Advantage plans. A lot of bigger learning curve. This is why you have to do that AHIP certification. But they're not that hard. They kind of work like the current insurance you have now. All right, and they do include prescription drug coverage. With Medicare Supplements, you actually do have to buy standalone drug coverage. But okay. So, advantage of Medicare: lower premiums, more plan choices. They include extra things like dental, hearing, and wellness. Disadvantages: they're not guaranteed renewable. Sometimes they discontinue. You may have to buy a new one. Networks can change. Doctors can fall out of networks, so you have to change your plan. There's sometimes high co-payments. You have to kind of review these every year. So as long as you can tolerate, for me, I don't mind changing doctors. It's not the end of the world for me. But some people really like a certain specialist, a certain doctor, and they just can't tolerate having, this doctor is no longer taking this plan. I have to change the plan again, or I have to change doctors. So, some people just want to do the supplement, pay $100 and be done with it. They don't want to worry about it. So, there's goods and bads of each. And the Medicare Advantage plans, the problem I have with them, I guess, is this right here. This love him as a football player, but, every time this commercial comes on, I've got 700 Medicare clients out there, 600. All I hear from them is, well, am I getting all the stuff I'm supposed to be getting? I see this commercial on TV. I'm not sure if I'm, so, we'll help you combat this. We'll help you with the kind of stuff for that. But this is out there. They're advertising these things, and that's why I tell people, if you're going to do Medicare work, you might as well do both Supplements and Advantage, because they're here to stay, and they advertise the living dickens out of these things. It's probably once a week I have someone call me and say they saw a commercial on TV. They want to make sure that and I kind of go through it all. Sometimes, again, buying a Medicare Advantage plan, getting a free teeth cleaning sometimes isn't worth changing your doctor or having to then pay copays on your rest of your stuff. So you really kind of have to explain how both of these plans work to people. I think a lot of seniors get kind of duped by the Advantage plans. Not that they're bad, it's just they don't understand all the benefits. So we'll help you with that. Okay. Prescription drug plans, again, these are drug plans that are run by the government. There's probably going to be anywhere from 25 to 30 drug plans available in any zip code in America, different companies. And so depending on what kind of drugs they're taking, if there's someone who has one drug, it's a high blood pressure medication that they take, it's generic, it's $1 a month. Well, they can go on a very low cost, $7 a month Aetna Silver Sneakers drug plan. Otherwise, if they have like 12 medications, I'm going to show you some of this. Then they may want to buy more of an elaborate one that covers those drugs better. All right. So I want to get to the low-hanging fruit here. Let's have at least 10 minutes of showing you some things that I do to get started. Right mix of carriers. Okay. So which carrier should I have? And for that, we again, GoldenCare carries all the major names, all the major carriers. Top sales, you got United Healthcare is number 1, Mutual Omaha is number 2, Aetna's 3, I think Cigna's 4, Transamerica. All these are your big name companies. I'm always suggesting you carry a couple of these just for name's sake. You want to have the big name. So let me go into CS Actuarial here. Now, this is a free tool you have by getting licensed with any of our carriers. We're going to hook you up with CSG Actuarial. And you can go onto this website then, and I'll show you. Matter of fact, I'm going to do that now. And we're going to kind of go off the menu here a little bit here. I'm going to get to the low-hanging fruit. So what products should I be adding? Well, oh boy. I lost my website. Bear with me. I'm working remotely. It's a little slow. Okay, so this is CSG, but this product is here. This basically tells me this particular. I have Gaffney, South Carolina up here. So let me just say, let's just search. I'm a guy that's from Dayton, Ohio, and I'm just going to guess a zip code here. I think it's going to be 45405. I think is the date. 405. Yeah, 405. I think I just did one there. All right. So I have a 65-year-old. Again, this program is available on our website. You can register for it. You'll get a copy of this PowerPoint, which will tell you how to register this. So, okay. So here we go. So I know that for a female, for Plan G, in this zip code, this is Montgomery County, Dayton, Ohio. Okay? You can do this for any county in America, and I would suggest right now, for those of you on here, get on CSG, go ahead and put your zip code in there, and we're going to take a look at which carriers you should have. So, okay, what does this tell me? Boom. You can actually enroll people for this platform. I was hoping to get to that, but I did not. Okay. So right now I can tell you that AARP, there's #1 in national sales. United Healthcare's AARP plan, $94. That's full coverage, med sup. What else we got here? Erie family, that's probably a local one. So if you're in that area, you might want to pick that one up just for local. Some people like local companies. I personally, just for, you really want to have a big name company. The bigger the company, the safety in numbers. These big, huge national companies, they're insuring the whole country. So if you have really kind of a bad thing, some of these small regional ones might run into trouble with, it's just a smaller pool. So I do like the protection numbers of big ones. Okay, so here in this market, I've got AARP. Here's Aetna Continental. Continental is also marketed as Aetna. Aetna markets under a couple names. So that's #3 in national sales. So you've got AARP at $94. You've got Aetna Continental at $100. That's A-rated. 29 years the market. Big behemoth company. AARP has a couple offerings. This is because they offer a discount if you have the thing for the first. It's another whole webinar how AARP markets, but AARP is the big dog in town. They offer 15% discount your first year, 10, and then 5, so it kind of staggers down here. That's why that's another. Here's Mutual Omaha. So in this market, if I'm Dayton, I would probably grab Aetna, Mutual Omaha, and United Healthcare. That's #1, 2, and 3 in national sales. That pretty much gives me three of the top 7 companies in that zip code. So now, granted, if you look at how many companies are selling that product in this market, we go all the way down here. Something called Community Insurance. That's by Anthem. Excuse me, read that. Oxford Life, United Insurance Company, 112. Keep going here. How many are there? Looks like we got 43, 44 companies. All right. So you even got, AARP, some of their old plans, they introduced there long ago, $330. And some poor people out there are paying $330 for something they could be paying $100 for. That's right. It's one of the low-hanging fruit I want to show you. I'm going to show you how to go get these people and help them out. But still, a Colonial Penn is charging $285. Assured Life Association, $230. Remember, these plans are identical. So there's really no reason to spend $170 on something that's $100 when the company's A-rated. It's bigger. It's got more stability. And so this will show you the ratings. Like this company here, Everence, not even rated. They have been in the market for 29 years. There's no rating on AM Best, no S&P. And it's $166. I'm not sure I'd sell Everence. But if I walk into a house and I see someone has an Everence, or talk to someone on the phone, or talk to someone at church that has that, I'm going to suggest that they go ahead and get one that's a lot cheaper. They should be looking at a United Healthcare. All right. So anyways, this is how you can. So now to pick up the right carriers, this is how I do med sup. Now up here, I'm going to change this to. Let's take a look at the Medicare Advantage and PDPs. Okay, here I've got zip code. What do we use? I'll choose a different one. And I'll just do 97322. That must be New Jersey area. Then we'll do the Medicare Advantage plans. That's Lynn County. Looks like it's New Jersey. You thinking? Yeah, this is remote, so I've got a little bit of delay here, folks. Bear with me. Okay, 234. I do want to get to 10 more minutes to show you. Just the CSG is a heck of a tool. It's outstanding to look at what you're getting here is the premium rates for what every company does in that zip code for Medicare Advantage, for Part D drug plans, and for Medicare Supplements. I use this tool daily. It's that valuable. It's just nice to know no matter what. I work in a lot of states, but again, if you're just working in your own state or your own area, if you want to know what the competition is, it's nice. So here's a Medicare Advantage plan. So you got United Healthcare's got a 0 premium one there. Something called Moda, WellCare, another big one. Samaritan, that must be a local one. And so if you want to get the Advantage plans, I'd probably grab a couple of these that are reputable companies. I would maybe grab United Healthcare. The plans are good. Humanas are good. Aetnas are good. Maybe Regents, Anthem. So you can grab all these. Then finally, again, if I'm in an area, let's do a different zip code here. I'm going to put, let's put 3004, or that might be. And I'm going to go to Part D plans. All right, so what zip code is 30004? Alpharetta, Georgia. All right, just north of Atlanta there. So if I'm in Alpharetta and I'm shopping drug plans, okay, so remember, some people might be taking one drug, some people might be on a whole bunch of expensive meds. So when you enter the Medicare, you have to buy a drug plan or you pay a penalty. So if I have someone that's sitting there with only one, for 2022. So I'm going to go now. That's what it should be. Where's the silver scripts? Come on. Let's go to the top. Huh. Must be still thinking here. Oh. That doesn't seem right. There should be where's silver scripts. So depending on what their drug use is, let me do a different zip code here. Like people in North Atlanta don't have that silver scripts available, right? But this is, again, so put your zip code in so you know what area you're going to be doing or what plan you're going to be working. So to pick up what carriers to have, and again, you can call and I can help you walk through this, but I'm going to go on to a quote. Looks like it's thinking. Don't tell me CSG is glitching on me now. Yeah, that's not right there. This is they have the plan start at $7. I'm not sure why that's doing that right now. Huh, that's interesting. It's not the same for, that just changed. Okay. No? Great. So now I had the website not working correctly. It's still kind of spinning here, so I'm not sure what's going on. Could be remotely, but all right, let's go back to my PowerPoint. Let me go into low-hanging fruit here and show you what I'm kind of doing just to get your first couple apps in this business. All right, we're getting started. I call it the low-hanging fruit up there. I help people who already have supplemental coverage in force. They've already got drug coverage in force. But because there's so much thrown at them, or I don't know what happens to people, honestly. I don't know if they hear from some have maybe only had one company. They're not a broker. They can't shop different plans for them. Whatever the reason is, they're sitting on a plan that's just not a very competitive plan. I'm not even sure how they get it. Now, the supplemental companies also move rates up each year. So I'm going to show you just an example. Now, I had a client of mine. Her name was Arian McKee. This was 2 weeks ago or a week ago. Matter of fact, it was October 1st effective date. So yeah, I think it was the last couple of days of September. She called me up and she had Plan F. Her and her husband, both. So she was 76. Her husband was like 81. He was paying $320 something for Plan F. She was paying $261. So I went ahead and went on to CSG. I put in her zip code in Gaffney, South Carolina. And lo and behold, for a 76-year-old woman, for Plan F, current rates, $168.43. That's with Mutual Omaha, the same company she has. So why is it that Mutual Omaha is charging a lot less for brand new customers? Well, that's how it works. Every company does this. Cigna, Aetna, United Healthcare. The rates go up and up once you buy it. So you should always reapply every 3 or 4 years because they're trying to buy the business at when people are trying to shop and change plans. So it's their lowest rate possible. Well, they're not making money at 168. So over time, they raise those rates. So the people basically that had a plan anywhere over 3, 4, 5 years are paying way too much, and they should be switching. Companies don't tell them this. They don't know. And so with Ari, she likes Mutual Omaha. She never had any problems with them. They always paid her claims. I told her we could even, we could look at different carriers, but she didn't want to leave Mutual. She just wanted to stay with Plan F. And so I showed her it was 168 for Plan F. She had Plan F because remember, she was before January 1st of 2020. I suggested she went to Plan G, which we finally eventually did. So if I go into CSG here, hope it's going to work now, then I'm back in there. What was her zip code again? It was 29341. So I mean, again, this is. So she calls me up. She says, "Jeff, I'm paying $261 for Plan F." I tell her we can do better than that. So at $261, and her husband was paying, I don't know, $315. I open up my CSG, 29341. Let me go in your zip code. And it better work. I mean, I was just working earlier. I can't believe this is not working now. 29341. Okay. 76-year-old. Oh, we're going to do Medicare Supplements. We're going to go back to supplement here. Okay. 241. Maybe not to show as many. I'll just do the Ari McKee example here because I got a couple more similar. I got a guy called me from Dayton. I got another one called me from North Dakota. Same thing. So if I put her zip code in here, 29341, 9341, and I'm looking at Plan F. Okay. Run quote. So Plan F. Oh, at 76. So she's 76. Needless to say, when I told her what she could, the same coverage she has. Let's just take a look here. And she is actually married. Her husband still has a Mutual Omaha plan, so she gets the married discount. I don't know if I put that in here or not, the slide, but all right, there we go. So this is what current companies are charging for Plan F. Here's Aetna, 148 or 150. Where's Mutual Omaha? All right. Mutual Omaha, 168.43 for Plan F. So if you look at my slide here, I told her, look, you're currently paying $260. How would you like to pay $168 for the exact same coverage with the exact same company? Of course, we did an electronic app that. But then I actually went a little further for her. I said, Ari, and this is something I help a lot of folks with. Plan F is just getting more expensive. They don't write it anymore, and so everyone that has Plan F, there's no more new Plan Fs happening anymore. So that's just an old aging block that's getting more and more unhealthy, having more rate increases. So I said you should go to Plan G. So I kind of explained to her that, and plus because her husband already has a Mutual Omaha plan, I can apply the discounts here, so it's a married discount. And so I went ahead and went to Plan G for her. Okay. She was very pleased to find out that new rate now is $122 instead of $261. The only difference is she has to pay the Part B deductible. With Plan F, she didn't. So it's $203 a year. So I saved her. Let me find that rate. I think it was 122. And there's 115. Signal again. This area. If I was in this area selling, I'd probably grab maybe Medico, a little less known name, but they take on a little bit more risk. You always want to kind of add a couple big names. Maybe you want to add a local. Then you want to add one that takes on a little bit more risk. So when you are changing from carrier to carrier, maybe they have some high blood pressure issues. You want one that's going to take on a little more risk, and I can help you with that, or we can help advise you with that. If you got someone with some medications. Okay. So I'm being told 5 minutes here, and I got to fire up the stuff downstairs. Sorry about that. I think the water restoration folks are here. Okay. So let's see. 4. All right. Where is Mutual? Oh yeah, 122.63. So when I tell Ari, so she's pretty glad she called, right? So in other words, for about the same coverage she currently has, 122. Now her husband had emphysema, and so I couldn't write him. He wasn't able to move. So this doesn't just work guaranteed. People have to be able to move. But she passed underwriting at 76. I asked her the questions over the phone. She answered no to all of them. We went to the electronic porthole. We entered her, and I probably did this all total in about a half hour. So she couldn't be happier. Now she called me, and I'm her new favorite person from Minnesota now, because I saved her $140 for the same coverage she have. That's significant money. That's $1,800. And for her and her husband living on a fixed Social Security income, I can't tell you how big that was for her. She has a small pension, Social Security. I put $140 extra a month in her pocket. She's just so happy. Well, now we're going to actually change her drugs around because her drugs are kind of expensive. I'm kind of running out of time. I wanted to get to that, but so the low-hanging fruit, folks, and I just want you to, for this webinar, here's another one where a guy called me in, and I didn't run these rates, but if I did, so here's one here. I saved this for the webinar. This is Keith Dorsad from Grand Forks, another client of mine, age 69, has Plan F with National Health Insurance, Allstate company. Okay, he's paying $238. What's his zip code? Do one more, and then we'll kind of wrap this up. 58202. Okay, so quickly here, 58202. 202. Okay, and this was I believe he was 71, male. He currently has all, I'm not going to get the discount for him, but for Plan G, so he's currently paying, how much was he paying in? He was paying $238. So I was able to call him up after I ran some rates. I actually emailed this to him and told him, how would you like, I think I used mutual up there too on this one. Maybe I sold him Aetna. Well, for me, I'm less a lot of them, so everyone could have been Cigna. I sold him $150 for Cigna. Mutual Omaha, yeah, I think I did. I think we added dental coverage for him. So $152.64. He was paying. There it is, $238. So I saved him $75 a month. Again, he was glad he called. So my point on this thing here, and I kind of want to wrap with this. I have a drug section I was going to show you as well. I was going to, I can go, and I don't quite have the time for this right now, but essentially what I want to tell you is this. There are people like this Keith, like Ari, like Doris from Dayton here. I could go on and on. Go talk to your aunts, your uncles, your mom, your dad, your neighbor, your friends at church, your acquaintances. Ask them if they have Plan F or Plan G. How long have you had that? Oh, like 5 years. Oh, we've been with this company for 6 years. They've been really good. They've paid all their claims. Of course they do. They're all the same. But if they have their health, they can go ahead and get the exact same coverage and save anywhere from $70 to $100 a month. This is routinely done. It's low-hanging fruit that's out there everywhere. Now, so if you get some cases and they have Plan F, give me their zip code. I'll show you how to do it on CSG. I'll help you write your first one or help you quote your first one. But go get CSG. You're going to copy this PowerPoint. And on here, Lynn's given links on how to sign up for CSG. But just shop the people who already have it. The other thing I was going to tell you is the drug plans. And we're just kind of out of time with this. But with the drug plans, I go to Medicare.gov. Couldn't be easier plan here. With Medicare.gov, you can go ahead and just preview the drug plans. You type in their drugs. You get the actual dosage. I think I have an example on my slide, but it calculates the plans for them. I run people's meds, and they tell me what they're paying, what plan they're on, and they'll tell me. So if I put in a certain zip code, and I put in 5 medications they're taking, and I pick out, I don't know, Walgreens, Walmart, CVS, and Rite Aid, it will tell me what the corresponding copay is for each med for every one of those meds. It'll add them all up. It'll add the monthly premium to the plan, and it'll tell me to the penny the correct plan to be on. I don't have to guess at this. And it's as easy as this. So you just go into your Medicare.gov. And the reason I use Medicare is because they can do this at home too. So when I send in the report, I can actually join screens with them, or I can show them how to do this. Trust me, you make a friend when you save them $1,000 on their drug coverage. So here I'm just going to continue on logging in. So easy to do the drug coverage. I want to do drug plans, right? I put a zip code in. Again, 55441. I'm not going to bother putting them all in right now for the reports, but again, I want to get done here at 10 after. And the internet being slow here too is really kind of. I don't get any other help from that out there. Okay. All right. So I'll tell you what. If you want me to help you get started in this, bring a client of yours that has a couple of drugs. I'll show you how to do this. Of course, I want to see the comparisons. That's it. I put yes. I want to see the compare. And then, boom, you add a couple of drugs. For this one, I'm just going to put a Tylenol in there. Add drug, 50 milligram, to 3 a day, sure. Okay, they're done adding drugs. You add a couple pharmacies, right? So in this situation, I'm just gonna grab the line out here. All right, there's CVS. There's Walgreens. And CVS. Okay, done. And then it computes for them. So then it lists. It takes the monthly premium, and then it adds the corresponding copay for what that drug might cost, and it tells me the penny. So when you run these for your people, there's a lot of companies run those drugs. I uncover so much money for people. I save them so much. It spits you out nice detailed reports telling them exactly what their drug costs each of the month. If I go to CVS, what's it going to cost me? If I go to CVS, it costs me $1. If I go to Walgreens, it costs me $73 at Walgreens. Don't go to Walgreens, right? So I can literally, to the penny, tell them where to get their drugs and how to save money. That's so invaluable. That's the 2 lowest hanging fruits. I'll wrap with that. That's the areas to get it. So when you, let's see, here's my Part D example. So I get a list of their drugs. I go to Medicare.gov. I type them in. I ask them what plan they're on. They're on this plan. It's like, that's the 17th highest plan you can get. Why don't you go on the best plan? And as far as adding those, you have to be AHIP. I would probably add, Aetna and United Healthcare and Humana. Be really dangerous. It's all you really need. Save people some money. Okay. So I'm going to wrap up with this. The low-hanging fruit, folks, is out there. It's easy to get. Call our office. You'll get a copy of this. If you want me to show you how to quote a couple, go and ask someone you know. Because how do you get started in talking to a parent or a friend or someone that you trust? Ask them what they're paying for Plan F. And at that point, just I'll shop it for you. I'll show you how to do it. Save someone you know some money. It'll help you scratch your first app, right? It'll help you get started just, getting contracted. And once you've done 4 or 5 of these, I'm telling you, you're off and running. We'll teach you how to drug plans. It's not that hard. So there's other things, social media, direct mail leads, drops, all the stuff you see from all the shops. I'm going to try to tell you how to actually go get apps right away. So this kind of went longer than I wanted to. Sorry about the delays with the stuff. I know that we have a chance for a $100 Amazon gift card. This is also going to come in the presentation. I have not even seen this yet. Lynn just added this. Thanks, Lynn. Let's see. For writing, I think, 1 app, for using any of our tools and writing an app, we're going to give you $100 towards Amazon. You'll get a copy of this. So with that, I just want to thank you guys for coming on board. Now, the marketing number is 800-842-7799. Give us a call. I'll show you again. I know we got a little hurried there at the end, but there are literally millions of folks out there in your area, people that that are overpaying for what they already have. So it's annual enrollment period right now. They're shopping these anyways. The 2022 drug plans are out. Go ask people for, a list of their drugs. Most of them get a pharmacy report. Ask them if they have Plan G or Plan F. What are you paying for your supplement coverage right now? Do you mind if I shop that? Give us a call. We'll show you how to do it. Or just use this PowerPoint, go on to CSG, get registered, and start shopping. We'll help you get contracted. Look up your zip code, see what plans are strong in your area. And I'm telling you, you can help so many people. And you're not even selling them. You're just selling what they already have. You're just improving their coverage. So that's my idea for getting started. I want to thank you guys for coming on board. I know it's within an hour here. So I'm going to pop up into questions. There's probably a lot. We're going to do a follow-up on this. We're probably going to do this webinar again in not too long, and I'll go more to the end of it quicker. This is my first go-through on it, so we might scrap some of the stuff. So I appreciate your patience. Bearing with me here. Questions? It looks like we do have. Yes, we support MAs. Medicare Advantage, I did talk about that. It's about 50-50, 40% in some markets. So all those are pretty basic. We do have Silver Script. I want to thank everyone for coming on board. I have some cleaners here that have to get started, so I apologize for rushing, but thanks for coming on board. You will get a copy of this PowerPoint, and good luck selling out there. And again, 800-842-7799 is our number, and you'll get more information about the incentives and stuff for getting started on Medicare. Thanks a lot, folks.
Check out our website, goldencareagent.com, or give us a call at 800-842-7799.